Welcome to This Explainer. If you've recently started a new medication for your ulcerative colitis, or UC, huge congratulations. You are officially on the path toward feeling better and, really protecting your long-term health. Today, we're going to walk through a warm, completely jargon-free guide to advocating for yourself at your next gastroenterologist appointment. We'll be looking at 9 absolutely essential questions you should bring with you. Please keep in mind, though, that this explainer is strictly educational. It's not personalized medical advice, so always consult your own doctor for your specific needs. Let's dive in. Okay, here's our roadmap for today. We'll cover setting your treatment goals, timelines and doctor check-ins, mastering your medication routine, protecting your long-term health, when medications stop working, and finally, prepping for your next visit. Section 1, setting your treatment goals. This is all about the big picture of what we actually want to achieve. That brings us to the very first question you need to ask your doctor. What is the goal of my treatment? Now, it's the most natural first question to ask because while feeling better is your obvious immediate goal, your doctor is actually aiming for a much more specific medical target. They aren't just looking to mask your symptoms. They literally want to stop the disease in its tracks. And that target? It's called endoscopic remission. To put it simply, this is when the inflammation in your colon has truly settled down and the disease is totally under control without needing to use steroids. It's all about deep healing on the inside. Your doctor will confirm this deep healing later on with tests like a colonoscopy or stool samples, just to make absolutely sure the tissue itself is actually recovering. Which leads directly to our second question. How will I know if my treatment is working? It's a completely valid question. You want to know what to look for day to day. You should certainly notice improvements in how you feel. Things like a drop in fatigue, less cramping, and fewer urgent trips to the bathroom. Keeping a quick daily journal of these changes is a fantastic way to track your progress and share it with your care team. But here's the crucial thing to remember. There is a vast difference between simply feeling better on the outside versus achieving true inflammation-free healing on the inside. Look, symptom improvement is wonderful. It means you can get back to living your life. But underlying healing is the absolute gold standard. It means your GI tract is actually free of inflammation, completely protecting you from future flare-ups and complications. Section 2, timelines and doctor check-ins. Let's talk about knowing what to expect and exactly when to expect it. For our third question, you'll want to ask, how long does the medicine take to work? It's super important to know this because different medicines have totally different time frames. Some act way faster than others. Doctors use standard milestones to check your overall progress. Setting these expectations early on prevents you from getting discouraged if you aren't feeling 100% better on day 2. In a typical timeline, your doctor is going to do an initial check-in at about 8 weeks just to see how your body is responding. But the much bigger milestone happens around 16 weeks, where they check to see if you've actually reached that goal of remission. If the medication hasn't brought you into remission by week 16, well, your doctor might suggest trying something else. And that's okay. You are never stuck on a path that just isn't working for you. Bringing up our fourth question, what type of monitoring will I need, really helps you understand how your care team tracks those 8-week and 16-week milestones. Regular checkups are a totally vital part of UC management, even on the days you feel absolutely fantastic. To monitor you, doctors are going to use a combination of tools like blood tests, stool tests, endoscopies, or even intestinal ultrasounds. So the crucial point here is that regular monitoring is designed to stay ahead of problems before they even happen. By checking your labs, your doctor can ensure the medication is working safely and effectively, keeping you on the right path to long-term wellness. Section 3, mastering your medication routine, managing those day-to-day doses and side effects. Question 5 is a big one. What's my dosing schedule? Whether it's daily pills, self-injections, or clinic infusions, strictly following your prescribed routine is what prevents that inflammation from returning. If untreated or just inconsistently treated, UC inflammation can quickly flare back up. You should always call your doctor immediately to find out next steps if you miss a dose or an appointment. Never just double up on your own. For question 6, you'll want to ask, what are potential side effects? Every single medication has them, and knowing what's a normal side effect versus what's an actual warning sign is incredibly empowering. Asking about side effects early on means your doctor can make swift adjustments before minor issues turn into much larger problems. While side effects like headaches, fatigue, or maybe an injection rash are pretty common and manageable with these advanced therapies, you really need to know your red flags.
Symptoms like a sudden fever, pneumonia signs, or UTI symptoms, those could signal a serious infection. If you experience these red flags, it requires a call to your doctor ASAP. Knowing the difference keeps you safe and calm.
Section 4. Protecting your long-term health. Looking beyond just the immediate symptoms. For question 7, you should definitely ask your doctor, how can I avoid long-term complications? Because some biologic therapies carry a slight risk for liver problems or certain cancers. You'll want to ask your doctor about routine safeguards. Now, this shouldn't cause panic. It just means staying on top of preventative care, like scheduling annual skin checks, staying current with cervical cancer screenings, and getting routine lab work done. Question 8 is great because it puts the power back in your hands. What lifestyle changes can support my treatment? This really recognizes that while medication is absolutely the foundation of your recovery, your daily habits matter too. Medicine doesn't just work in isolation. Research actually shows that adopting certain daily habits can be incredibly beneficial. Managing your daily stress, exercising regularly, and getting proper sleep can literally lower your flare risks and significantly improve your quality of life. Conversely, it's pretty wise to avoid consuming alcohol, which can sometimes make symptoms and inflammation worse. These are actionable things you can do every single day to support your body. Section 5. When medications stop working, putting a solid safety net in place. By asking our 9th and final question, what happens if my medication stops working, you create that safety net. You want to know exactly what to do if you notice a sudden flare or even a gradual return of symptoms like mild bleeding or urgency. You should never, ever just wait it out or assume things will magically settle on their own. What's really interesting here is that up to 35% of people with UC will eventually switch to a different medication because their current one stops working. 35%. That's more than 1 in 3 people. So you should never feel like a failure or that you did something wrong if you need to switch. There are so many other advanced therapies available today, and you and your doctor will simply pivot together to find the next best option for you. Section 6. Prepping for your next visit. Taking action today. All right, here's your game plan. Step 1. Write down or screenshot these 9 questions. Step 2. Bring the list to your next appointment. Step 3. Discuss them openly with your gastroenterologist. You are your own best advocate, and asking the right questions is the absolute key to getting the right care. With new advanced UC therapies being developed every single year, isn't it time to demand a treatment plan that offers true, deep healing? Write these down today and take that very first step toward your own long-term remission. Thanks for joining me on this explainer, and here is to your health.